Whether you're looking for that dream body or just looking for a fun, family-friendly place to do some anaerobic exercise, the anaerobics gym is definitely the place for you. And like that fastidious staph infection I got from the machines here, I can't stop coming back. And I know once I'm done showing you the facilities, you'll feel it too. So let's take a look around, shall we? Okay, I know I don't need to remind you, but if you're going to use some of the machines today, make sure to wipe them down afterwards. The Keep Clean sign is our recurring symbol for clindamycin. Just a friendly reminder, don't be that guy. Anyways, before we get started, let's stop at the front desk and go over your membership options. We've got your basic plans like our 30, 30S packages. We've got our premium 50, and you know what? You remind me of a young Carl Weathers, in other words, a young me, so I can already tell you're going to go straight for that 50S package. And he can set you up now at the front desk, right over here. Notice the typewriter at her desk. Look familiar? It's a recurring symbol for antibiotics that work on the bacterial ribosome. Clindamycin works just like a macrolide. Remember that Edgar Allan Poe typewriter? Yeah, super creepy, right? It binds the 50S ribosomal subunit, blocking translocation, thus inhibiting protein synthesis. Whenever you see the ribosome typewriter, think of a paper jam representing bacteriostatic. So it looks like she's having a little trouble printing out your membership form, so let's just head inside, shall we? There are only a few bugs you need to keep in mind with clindamycin. It's effective against gram-positives, like staph and strep, and it's effective against anaerobes, such as Clostridium and Bacteroides. You know, that one that hides out in the back of your mouth. Clindamycin's activity against gram-positive organisms will be represented by the weight rack over here on the wall. Notice the round coccus shapes arranged in clusters and chains, representing staph and strep species, purple to represent gram-positive. It looks like our newest gym member is at the gram-positive weights now, and he could use a little help. Well, at the anaerobics gym, we've got your back. Need a little encouragement? That little nudge to set you in the right direction? We've hired the best personal trainers in the business. Why is he holding up that pie, you ask? Well, clindamycin penetrates well into tissues. It's indicated for skin and soft tissue infections caused by staph and strep, such as invasive Group A streptococcal infections. Our sketchy symbol for Group A strep skin infections is strep pyogenes, a flaky pie, with the puffy red oven mitts to represent soft tissue infections like cellulitis. It's an advanced training technique, but here at Anaerobics, we'll stop at nothing to get you motivated. No pain, no pie. Clindamycin is often active against community-acquired strains of methicillin-resistant Staph aureus, or MRSA. And if you take a look at the trainer, he has our gym's other subtle yet encouraging slogan tattooed across his chest: No mercy. Whenever you see No Mercy in one of our sketches, it indicates activity against MRSA, along with our recurring Merciless Pharaoh from our Staph aureus sketch. On an exam, always remember the big guns for MRSA first, especially in serious systemic infections. So check out our vancomycin, daptomycin, and linezolid sketches for more extensive coverage of MRSA. Hang in there, my friend, you got this. That pie, though, so golden and flaky. Anyways, remember our gym specializes in anaerobic exercise, so the rest of the gym will represent clindamycin's anaerobic coverage. Take a look inside the steamy locker room and you'll see a gas mask, a recurring symbol for anaerobes. Clindamycin is actively transported into macrophages, so it can achieve excellent penetration into abscesses. Important for you to remember are lung abscesses caused by anaerobes. This will be represented by his tank top, rife with abscess-like holes in the chest. And before you think too much about whether he washes that in between workout sessions or not, I'll remind you of an important cause of lung abscess: aspiration pneumonia. When an exam question points to aspiration pneumonia, Think of causative pathogens such as airway strep species and oral anaerobes. Clindamycin has some coverage against strep, as I mentioned earlier, and it's effective in treating oral anaerobic infections like those caused by Fusobacterium and Bacteroides. Always remember Bacteroides in the back of your mouth. And here we have one of our gym members rehydrating with Bacterade. These oral anaerobes can cause oral infections and can be important pathogens leading to aspiration pneumonia. So he probably shouldn't be drinking that while lying down. Keep aspiration pneumonia in mind when an exam question involves a patient with reduced consciousness, such as in alcoholics or anesthetized patients. Upper GI disorders, like dysphagia or protracted vomiting, or upper GI procedures, such as intubation or NG tube placement. Some students like to remember Clinda for anaerobes above the diaphragm and metronidazole for anaerobes below. This is almost always true on an exam, but in clinical practice, clindamycin has a few important indications for treating infection not involved with oral anaerobes. One bug to keep in mind is Clostridium, and an important Clostridium species to remember is Clostridium perfringens. Trauma such as road rash can introduce some fastidious anaerobes, leading to gas gangrene and myonecrosis. So clindamycin is often indicated to cover these anaerobes. It looks like someone got a little too excited on the exercise bike, causing it to topple over. His sweatpants are perforated, a recurring theme when we want to highlight Clostridium perfringens coverage. Road rash from a stationary bicycle. Okay. Topical clindamycin can be used to treat moderate to severe inflammatory acne caused by skin anaerobes. Take a look at the inspirational poster that sits in front of our exercise bike. It's none other than the beautiful and awe-inspiring French Alps from the Tour de France tetracycline sketch, also resembling white-capped acne lesions. How majestic. Another infection to keep in mind is endometritis. When cervical infection, such as chlamydia and gonorrhea, is untreated, these bacteria can ascend the upper genital tract and cause pelvic inflammatory disease. On an exam, always think of an antibiotic regimen that targets chlamydia and gonorrhea first, usually doxycycline and cephalosporin. Remember that for treating pelvic inflammatory disease. Inflammation of the endometrium, though, can also be associated with retained products of conception following delivery, septic abortion, pelvic abscess, or a foreign body such as an IUD. The female genital tract infections that result are often polymicrobial in nature due to the constituents of the vaginal flora, so antibiotic regimens are often used to cover anaerobes. One such regimen is gentamicin clindamycin. Think of gently cleaning the uterus. See that weight machine next to the keep clean sign? It looks kind of uterus-like. This is to remind you of clindamycin's role in treating serious infections of the female genital tract that can be polymicrobial in nature. The gym member using the machine is wearing a judo gi with a couple sai at her belt. This is to remind you of the aminoglycoside, gentamicin, that can be paired with clindamycin to give it broad coverage. You can learn more about gentamicin and mixed martial arts in our aminoglycoside sketch. Another important genital tract infection to keep in mind is bacterial vaginosis. Clindamycin has good activity against Gardnerella, the causative pathogen. At Sketchy, we represent vaginosis with a red Venus flytrap, and we have a collection of them next to the woman at the front desk. This small flytrap garden is our symbol for Gardnerella. Check out our Sketchy micro video for more info. Before we finished, I wanted to show you our ultra-modern bathroom facilities, but it looks like they're just a bit out of order. The most common adverse effect caused by clindamycin is diarrhea. Typically, the diarrhea is mild and self-limited, but clindamycin is also associated with pseudomembranous colitis caused by C. diff. Our symbol for C. diff is usually some kind of chocolate fountain, and here we have another kind of fountain. Although C. diff colitis has been documented with almost all antibiotics, clindamycin is frequently implicated. Antibiotic-associated diarrhea can occur during antibiotic therapy or even several weeks after the cessation of therapy. So I'll show you guys the restrooms some other time. Let's sum up this sketch. Clindamycin works at the bacterial ribosome. It binds to the 50S subunit just like a macrolide. Remember, our typewriter kind of conveys a paper jam, meaning bacteriostatic. Clindamycin works against gram-positive infections such as staph and strep skin infections, and even has MRSA coverage. On the anaerobic side of the gym, remember that clindamycin can penetrate abscess as well. For the exam, remember lung abscess. This can be in the setting of aspiration pneumonia, which can be caused by oral anaerobes such as Bacteroides and Fusobacterium. Clindamycin's anaerobic coverage can also be important when treating Clostridium perfringens infections, inflammatory acne caused by skin anaerobes, and in polymicrobial infections of the female genital tract. And at the front desk, we have our symbol for bacterial vaginosis caused by Gardnerella. The one side effect to keep in mind is diarrhea, and it can even lead to C. diff colitis. Well, that's the rub. Always remember, what's next to godliness? Clindamycin.